first class of drug used in the asthma known as adrenergic drugs or sympathomimetic drugs. Sympathomimetic drug. And you know that आपको मालूम है अपन we have seen the drug acting on the ANS sympathomimetic, sympatholytic, parasympatholytic. So we in that we have also seen the different receptor. So alpha 1, alpha 2, where is their location, what is the role? Beta 1, beta 2, beta 3, where is the location, what is the role? You know that beta 2 receptor is present in the bronchi, smooth muscles of bronchi. So where it causes the relaxation, bronchial smooth muscle relaxation, and it causes dilation of bronchi. So that's why adrenergic drugs or beta 2 agonist. So bronchodilation due to beta 2 stimulation effect. So bronchodilation due to beta 2 stimulation. Okay, so when this agonist will combine with the beta 2 receptor, it will increase the production of cyclic nucleotides, cyclic AMP, cyclic AMP or cyclic GMP in the bronchial muscle cell, and increase the concentration of CMP or cyclic GMP. It causes bronchial muscle relaxation in the muscle cell, and increase the amount of cyclic AMP in the mast cell and other inflammatory cell will decrease the release of mediators for the inflammation. So their action is dual action. पहले तो क्या करेंगे, जो बीटा सेल्स बीटा रिसेप्टर होता है मसल सेल के ऊपर ब्रोंकियल मसल, तो वहाँ पे जाके एक्ट होंगे. दे विल इंक्रीज द साइक्लिक ईएमपी लेवल इनसाइड द सेल एंड कॉज relaxation of bronchial smooth muscle. And in the mast cell or other inflammatory cell, they will prevent the release of inflammatory factors. Okay, both actions contribute the bronchodilation caused by beta 2 agonist. Okay, whatever the beta 2 agonist are used. So like for example, beta 2 agonist, see adrenaline is also agonist to beta 2 receptor, isoprenylene is also agonist to beta 2 receptor, but they are known as a non-selective agonist, and you cannot use non-selective agonist in this अस्थमा बिकॉज पता चला कि बीटा 2 रिसेप्टर को स्टिमुलेट करके ब्रोंकोडाइलेशन करना है आपको, और बाद में वहाँ पे हार्ट रेट बढ़ गया. So that should not be happen. So adrenaline, isoprenaline, they are non-selective, and that's why they causes cardiac adverse effect. That's why they are not used. So who are used? So selective beta 2 stimulant. Now ephedrine is a sympathomimetic alkaloid. You know that ephedrine is a sympathomimetic alkaloid obtained from Ephedra cereata. So it is again a non-selective. It will stimulate alpha 1, beta 2 receptor. Ephedrine. It is sympathomimetic. It will dilate the bronchi for 3 to 5 minutes. Oh, sorry. It will dilate the bronchi for 3 to 5 hours. The action, it will start its action slowly but last for 3 to 5 hours. But this ephedrine has a low efficacy, low pharmacological adverse effect. That's why it is no more used nowadays. Now, which kind of drug are used from this category? Selective beta 2 stimulants. So highly selective beta 2 stimulant, for example, salbutamol, terbutaline, bambuterol, salmeterol, formoterol. So salbutamol is a highly selective beta 2 agonist which causes bronchodilation within the 5 minutes, and it will last for 2 to 4 hours when lasting for 2 to 4 hours when given by oral route. तो जब orally जब देंगे salbutamol, so it will, or injectably, so it will cause bronchodilation within 5 minutes and it will last for 2 to 4 hours. When it is given in the form of inhalation, in the form of meter dose inhalation, pressurized meter dose inhalation, it will dilate the bronchial within, sorry, this salbutamol is highly selective beta 2 agonist. It will start bronchodilation within 5 minutes and the effect will last for 2 to 4 hours when given by inhalation route in the form of pressurized meter dose inhaler. Now, if you give orally, the oral bioavailability, if you give this salbutamol orally, so oral bioavailability is 50%, and most of the drug is degraded by pre-systemic metabolism or fast part metabolism in the GIT. Oral effect will last for 4 to 6 hours. What are the adverse drug reaction? It is a dose-dependent muscle tremors, will cause dose-dependent muscle tremors, palpitation, restlessness, nervousness, throat irritation, edema that can occur. Now another drug is from same category known as a terbutaline. Terbutaline. Okay. So similar to your salbutamol in the other aspect, there are these two drugs, salbutamol and terbutaline. These are the most popular drug for quick reversal of bronchospasm. बहुत ही फेमस ड्रग है इसके ब्रोंकोस्पाज्म के लिए. salbutamol and terbutaline. Okay, but they are not used on a regular basis. इनको अगर किसी को अस्थमा है तो उनको रेगुलर बेसिस पे ये यूज नहीं कर सकते, बट रेगुलर बेसिस पे कौन सा यूज करते हैं? इनहेलेशन कॉर्टिकोस्टेरॉइड्स. So inhalation corticosteroids, they are used on a regular basis. Okay. Now next drug is a bambuterol. Bambuterol. Next drug is a bambuterol. Okay. We have seen this salbutamol, terbutaline. Salbutamol is a selective alpha 2 agonist, so it will dilate the bronchi within a 5 minutes and last for 2 to 4 hours after inhalation. Okay. Pressurized meter dose inhalation. Oral bioavailability is 50%. The terbutaline is similar to salbutamol, and these two drugs are very famous for bronchodilation. Now next one is a bambuterol. So it is a bicarbonate ester of terbutaline. क्या ये बायकार्बामेट ईस्टर ऑफ टर्बिटलिन, मतलब ये ईस्टर है तो अंदर जाके ब्रेक डाउन होगा बॉडी में और ये टर्बिटलिन ये रिलीज कर देगा, लेकिन स्लोली. So you can say bambuterol is it is a prodrug of your terbutaline. So bicarbonate ester prodrug of your terbutaline, then it is slowly hydrolyzed by pseudocholinesterase and it is used in a single dose in the evening. Single dose of 10 to 20 milligram for nocturnal chronic asthma. Nocturnal मतलब रात के समय का, nocturnal chronic asthma. Now next drug is a salmeterol. Next drug is a salmeterol. So it is a long-acting selective beta-2 agonist. It is a longer acting, used for the maintenance therapy of bronchial asthma, not for acute attack. It is used in the combination with corticosteroids. It is used in the combination with corticosteroids, and it reduces the dose of corticosteroids. And it is indicated in the combination with the inhaled steroids formulation. Okay, inhaled steroid formulation is also available. जैसे beclomethasone dipropionate plus salmeterol, ऐसा एक formulation होता है. Next drug is a formoterol. Formoterol. Next drug is a formoterol. So it is a similar to salmeterol, and the duration of action is 12 hours. In inhaled, long-acting beta-2 agonist along with the inhaled anticholinergic are used in the chronic obstructive pulmonary disease. Longer-acting beta-2 agonist along with the inhaled anticholinergic, मतलब ipratropium bromide, tiotropium bromide, okay, used in the COPD, chronic obstructive pulmonary disease. क्वेश्चन इसके ऊपर कैसे भी आ सकता है, मैकेनिज्म क्या है, कौन सा लॉन्गर एक्टिंग है, कौन सा शॉर्ट एक्टिंग है, कैसे भी क्वेश्चन आ सकता है. You can say over here the mechanism of action of selective beta-2 agonist. Suppose this is your bronchial smooth muscle cell. ये क्या है? bronchial smooth muscle cell है आपका. तो beta-2 agonist salbutamol, terbutaline, formoterol, salmeterol. These drug will combine with the beta receptor and will increase the formation of cyclic AMP from ATP. And cyclic AMP, increased concentration of cyclic AMP in the bronchial smooth muscle cell causes bronchodilation. Remember, okay, increased cyclic EMP in the bronchial smooth muscle cell causes bronchodilation. Increased the cyclic EMP's level in the mast cell prevent the release of inflammatory mediators. Also decreases the bronchial secretion by alpha stimulation. This is how they act. Now you can see over here another diagram. So beta-2 agonist, this is salbutamol, terbutaline, okay, bambuterol, then salmeterol. These drugs are the beta-2 agonists. They will act on a small airways. यहाँ पे आता कहाँ पे एक्ट होंगे? स्मॉलर एयरवेज. स्मॉलर एयरवेज मतलब क्या? तो देखो जो रेड जो पिंक डॉट है, पिंक डॉट स्मॉल एयरवेज. देन sorry, this red dot. Beta-2 agonist will act on a small airways and anticholinergic like ipratropium bromide, tiotropium bromide, they will act on a larger airways. तो यहाँ पे एक चीज याद रखो, beta-2 agonist like salbutamol, terbutaline, formoterol, bambuterol, etc. They will act on a smaller airways, terminal bronchi, ठीक है, terminal bronchi. And anticholinergic will act on a this larger airways. Larger airways मतलब मेन जो होता है, मेन ब्रोंकाई जो है उसके ऊपर ज्यादा एक्ट होता है. ब्रांचेस पे beta-2 agonist एक्ट होता है, ये बाद में आएगा आपको. Now next point is, next category of drug used in the bronchial asthma is a xanthine or methyl xanthine derivative. Okay, so caffeine, theophylline, theobromine, they all are nothing but the xanthine derivative known as a naturally occurring alkaloids. See, theophylline is the most commonly used from this category. जो मिथाइल xanthine है उसमें का थियोफाइलिन जो है वो मोस्ट कॉमनली यूज होता है, दैट इज द मोस्ट कॉमनली. So theophylline previously was used in asthma, but nowadays restricted to COPD. आजकल ज़्यादा यूज नहीं करते उसको. Some exceptional cases of asthma as a adjuvant. Mechanism of action क्या है इसका? This is the mechanism of action. So this theophylline and other xanthine derivative, they acts by three different mechanisms. First mechanism is they increases the calcium release from sarcoplasmic reticulum of the skeletal and cardiac muscle cells in the higher concentration. This action is not required for bronchial as an anti-asthmatic action. ये इसका action नहीं anti-asthmatic. This action second they act by inhibiting the phosphodiesterase enzyme. इसके ऊपर क्वेश्चन आ चुका है. One of the following is a anti-asthmatic drug is a phosphodiesterase inhibitor. तो जो भी थियोफाइलिन वगैरह, थियोफाइलिन नहीं मैक्सिमम, थियोफाइलिन, थियोब्रोमिन, मिथाइल जानते हैं. So act by inhibiting the phosphodiesterase enzyme. ये एंजाइम का रोल क्या है? This phosphodiesterase enzyme is involved in the metabolism of cyclic nucleotide. इससे होता है साइक्लिक जीएमपी, साइक्लिक एम, तो उनका मेटाबॉलिज्म करता है. अगर उनका कॉन्सेंट्रेशन ज़्यादा हो गया सेल में तो ब्रोंकोडाइलेशन हो गया, लेकिन ये क्या कर रहा है? उसका मेटाबॉलिज्म कर रहा है फॉस्फोडाइएस्ट्रेज. बट थियोपाइलिन इनहिबिट दिस एंजाइम फॉस्फोडाइएस्ट्रेज, एंड दैट्स व्हाई देयर इज an increase in the concentration of cyclic AMP GMP in the cells. Okay? So when cyclic nucleotide like cyclic AMP, cyclic GMP are increased in the cells of bronchi or cardiac or vascular smooth muscle cells, so it causes bronchodilation, then cardiac stimulation and vasodilation. तो जैसे ये साइक्लिक जीएमपी है, साइक्लिक एएमपी है, इसका कॉन्सेंट्रेशन अगर ब्रोंकिया में बढ़ गया तो ब्रोंकोडाइलेशन हो गया, कार्डियक सेल में बढ़ गया तो कार्डियक स्टिमुलेशन, वेस्कुलर स्मूथ मसल में बढ़ गया ब्लड वेसल के तो वैसोडाइलेशन. और इनका कॉन्सेंट्रेशन अगर इंफ्लेमेटरी सेल्स में बढ़ गया जैसे मास्ट सेल, तो ये क्या करेंगे? दे विल प्रिवेंट द रिलीज ऑफ इंफ्लेमेटरी मीडिएट. So bronchodilation, cardiac stimulation, vasodilation occurs. Inflammatory mediators are released or inhibited. So this is how they will act. They will also act by third mechanism known as by blocking the adenosine receptors. Okay, so this theophylline acts by three mechanisms. First, it will release the calcium from sarcoplasmic reticulum. It will inhibit. Second, it will inhibit the phosphodiesterase enzyme. Third, it will block the adenosine receptor. So adenosine is a local mediator in the CNS as well as cardiovascular system and other organ. So it contract the or it constrict the bronchial smooth muscle, contract the bronchi, dilate the cerebral blood vessel and depresses the cardiac pacemaker. तो ये adenosine receptor कहाँ पे होता है? bronchi में होता है, cerebral blood vessel में होता है और cardiac heart में होता है. So obviously adenosine receptor antagonists, they are used as a bronchodilator. They are also used adenosine. They are also used for paroxysmal ventricular tachycardia and also inhibit the gastric secretion. So they are blocked by methylxanthine. So adenosine receptor are blocked by methylxanthine. So obviously the action 2 and action 3, they are shown by this theophylline at a therapeutic concentration. That is responsible for the anti-asthmatic activity. Now you can see over here again, blockage of this adenosine receptor, that is A1 receptor by theophylline causes cardiac arrhythmia because it is non-selective. ऐसा नहीं कि सिर्फ एडेनोसाइन का रिसेप्टर जो ब्रोंका है उसको ही ब्लॉक करेगा, ये सबको ब्लॉक करता है एडेनोसाइन. It will block adenosine receptor present in the bronchi, present in the heart, present in the gastric acid gland, etc. Because of the blockage of adenosine A1 receptor, A1 receptor in the cardiac cell, it causes arrhythmia, seizures. Recently, it is also found that low concentration of theophylline will increase the histone deacetylation in the bronchial inflammatory cell and suppresses the pro-inflammatory gene transcription. ये mechanism of action है. दो चार पांच मैकेनिज्म है. देखो कैल्शियम का है, फॉस्फोडाइएस्टर्स इनहिबिशन का है, एडेनोसाइन रिसेप्टर का इनहिबिशन है और अभी नया नया आया है ये जीन ट्रांसक्रिप्शन. तो ये भी याद रखो, इसके ऊपर क्वेश्चन आ सकता है कि वन ऑफ द फॉलोइंग इज नॉट अ मैकेनिज्म ऑफ एक्शन ऑफ थियोफाइलिन. तो दो चार मैकेनिज्म देंगे आपको पता भी नहीं होगा, तो वहाँ पे कंफ्यूज नहीं होना. नाउ यू कैन सी हाउ जो सेल्स होते हैं जैसे आपका स्मूथ मसल ऑफ ब्रोंका है, इसमें क्या होता है जीटीपी या फिर एटीपी. एटीपी जीटीपी दे आर कन्वर्टेड इनटू साइक्लिक न्यूक्लियोटाइड्स. सो एडेनिन ट्राइफॉस्फेट, guanine, guanosine triphosphate. Adenine triphosphate is converted by adenyl cyclase into cyclic AMP. cyclic AMP कौन बनाएगा? Adenyl cyclase, and this GTP is converted into cyclic GMP by guanyl cyclase. Okay, cyclic AMP and cyclic GMP increase the concentration of these two. सेल में अगर इनका concentration ज़्यादा हो गया, that will cause bronchodilation. So increase the concentration of these two in the cell, bronchial smooth muscle cell. Bronchial smooth muscle cell cause bronchodilation. Now this CM cyclic AMP and cyclic GMP is metabolized by enzyme known as a phosphodiesterase. ये phosphodiesterase नाम का एंजाइम जो है इसको मेटाबोलाइज करेगा एंड कन्वर्ट इट इनटू 5 AMP and 5 adenine monophosphate and 5 guanine monophosphate and it will be inactive. So this phosphodiesterase enzyme is blocked by this theophylline. Now pharmacological actions of theophylline. Pharmacological actions of theophylline. CNS के ऊपर क्या है? स्टिमुलेशन. CNS के ऊपर क्या है? फार्माकोलॉजिकल एक्शन. वो स्टिमुलेट करेगा CNS को. Stimulation, increase in the motor performance, sense of well-being, and all this. We have seen these pharmacological actions of xanthines in this when we were discussing about the CNS stimulant chapter. इसके ऊपर क्या है? Stimulation, increase in the motor performance, sense of well-being, alertness. Higher dose will produce restlessness, nervousness, panic, insomnia, excitement, delirium, and can cause convulsions. Cardiovascular के ऊपर, cardiovascular system के ऊपर देखो. Stimulation and increase in the heart rate, force of contraction, increase in the blood pressure initially by acting on a vasomotor center. Because of the vagal stimulation, it will decrease the blood pressure. There's a bypassing response on blood. Okay, smooth muscle के ऊपर क्या है? Relaxation of bronchial smooth muscle. So aminophylline consists of theophylline plus ethyl diamine in a 85% and 85% theophylline. Theophylline 85%, ethylene diamine बाकी का 15% उसको बोलते हैं aminophylline. So the theophylline is well absorbed after oral administration. It is metabolized by demethylation. Metabolism कैसे होता है इसका? Metabolized by demethylation. Demethylation oxidation. So this theophylline is metabolized by demethylation and oxidation. Adverse drug reaction क्या है? It is a narrow therapeutic index drug. ये theophylline जो है, it is a narrow therapeutic index drug and it has a less margin of safety. So adverse reaction is attributed to GIT, gastric pain, okay, inflammation, headache, nausea, vomiting, convulsion, palpitation, cardiovascular के ऊपर ventricular arrhythmia, sudden death, syncope. It can produce arrhythmia, sudden death, and syncope. It has a drug interaction with various drugs. What is the use of this theophylline? Bronchial asthma, chronic obstructive pulmonary disease, and it is a respiratory stimulant in case of premature infant apnea. Apnea in case of premature infants because of respiratory stimulation action. Now next drug is, okay. So you can see over here the efficacy and bronchodilation with respect to dose of the theophylline. Theophylline का dose जैसे जैसे increase होगा तो क्या क्या होगा? ये देखो यहाँ पे प्लाज्मा ड्रग कॉन्सेंट्रेशन दिया है 5, 10, 15, 20, 25, 30 microgram per ml of theophylline. जैसे जैसे कॉन्सेंट्रेशन इंक्रीज होता है वैसे ब्रोंकोडाइलेशन तो इंक्रीज हो ही रहा है. 20 microgram 7.5 microgram to 17 microgram is nothing but the therapeutic range of this theophylline. Beyond this, what will happen? Adverse drug reaction. अगर therapeutic range में है तो minimal side effect बहुत ही कम. Therapeutic range से ऊपर उसका concentration गया तो क्या हो जाएगा? Dyspepsia, headache, nervousness, insomnia, restlessness, tremors, vomiting, palpitation, and diuresis. ये adverse effect already reported है. Yeah, these are the in the therapeutic range. Below the therapeutic range कोई adverse effect नहीं होगा. Within the therapeutic range ये restlessness, tremors, vomiting, palpitation, diuresis, dyspepsia, headache. Dyspepsia मतलब क्या है? Dyspepsia मतलब irregular acid secretion in the stomach. Headache मतलब क्या है? डोके दुखी. Nervousness मतलब क्या? बोर होना. Insomnia मतलब क्या? नींद ना आना. The therapeutic concentration beyond the therapeutic concentration, what will happen? It will produce agitation, tachypnea, flushing, hypotension. Tachypnea मतलब increased breathing. Hypotension मतलब if you still increase the delirium, cardiovascular status मतलब arrhythmia, increase the muscle tone, extrasystole, flushing, applied scene, then convulsion, coma, and finally death. That is the toxicity. So increasing the dose, toxicity will increase. It is having narrow therapeutic index. Now next class is nothing but the anticholinergic drugs. Next class is nothing but the anticholinergic drug. In that, you know that muscarinic receptors are present in the bronchi, M3 receptor. Muscarinic receptor जो है M3 is present in the bronchi and responsible for the bronchodilation. So okay, sorry, bronchoconstriction. Anticholinergic they are used. Atropine and its congener. So atropine will block the muscarinic receptor and cause bronchodilation. But because atropine has a very non-selective action, so atropine is not used. Ipratropium bromide, its derivative, is a short-acting 4 to 6 minute duration of action used in the form of inhalation anticholinergic bronchodilator. Inhalation anticholinergic bronchodilator. Ipratropium bromide, tiotropium bromide. Tiotropium bromide जो है उसका 24 आवर्स का ड्यूरेशन होता है. So they are having less adverse effect than beta 2 agonist जो salbutamol, terbutaline, formoterol, bombuterol जो है उसमें क्या होता है कि उसमें सिस्टमिक एब्सॉर्प्शन ज़्यादा होता है और एडवर्स इफेक्ट ज़्यादा होता है. This ipratropium bromide, tiotropium bromide will have a less adverse effect than beta 2 agonist because of the poor systemic absorption. Okay, they are used in the bronchial asthma and chronic pulmonary obstructive disease. Chronic obstructive pulmonary disease on a larger airways. We have seen that beta 2 agonist will act on a smaller airway and this anticholinergic on larger airways. Now another category of drug is known as a leukotriene antagonist. Leukotriene antagonist, leukotriene receptor blocker. Cysteine leukotrienes. Cysteine leukotrienes, LTC4D4. They are produced in the macrophages, eosinophils, and other inflammatory cells, and they are the main mediators for asthma. And their inhibitors like cysteine L1 blocker, like in Montelukast, Zafirlukast, Montelukast and Zafirlukast. Here the spelling mistake. MOE. Montelukast and Zafirlukast were synthesized. Both are having similar action. They block the cysteine leukotriene receptor 1 and therefore prevent the leukotriene mediated bronchoconstriction, mucus secretion, and increase in the vascular permeability. That is prevented. Movement of eosinophils also prevented. They will improve the function of, they will improve the bronchial function, they will increase the lung function, they will decrease the exacerbation of asthma. Both are used for the prophylaxis of bronchial asthma and they are safe. Okay, both are safe. Now adverse reaction क्या है इनके? Abdominal pain, headache, rash, then Church-Strauss syndrome, that is increased vascularity and eosinophil. Church-Strauss syndrome. Church-Strauss syndrome. They are well absorbed after oral administration. PO मतलब oral administration. Highly bound to plasma protein metabolized in the liver and excreted in the kidney through urine. Now Zeluton. Zeleutone is known as a lipoxygenase inhibitor. It is a 5-lipoxygenase inhibitor and also blocks some leukotriene C4D, leukotriene TB4 synthesis. Therefore, they block the leukotriene synthesis also. It is a lipoxygenase inhibitor and blocks the synthesis of leukotrienes. We have seen that when we were discussing anti-inflammatory drugs. Okay? So leukotrienes they will prevent the leukotriene induced bronchoconstriction through leukotriene receptor. Similar in action like Montelukast, it has a short duration of action. It is having hypertoxic potential. ये hypertoxicity कर सकता है बाकी कुछ mechanism याद रखो से. Then mast cell stabilizer, sodium chromoglycate. Sodium chromoglycate is a chromin derivative. It prevents the degranulation of mast cell and prevent the release of this histamine, leukotriene interleukins, but it will not antagonize them, but it will prevent the release of them. So it is ineffective in case of acute attack. ये ineffective है in case of acute attack. Acute attack में क्या होता है कि already release हो चुका है, तभी आपको अटैक आया है. तो acute attack में इसका कोई use नहीं है. It is used for the chronic asthma, for the prophylaxis, prevention of chronic asthma. It is not absorbed by oral route, so it is given in the. इसका यूज क्या है? ब्रोंकियल अस्थमा यूज क्या है? देखो ब्रोंकियल अस्थमा used for prophylaxis of bronchial asthma. Prophylaxis मतलब prevention. In allergic rhinitis, symptomatic relief for allergic rhinitis, in the form of eye drop for eye allergy, allergic conjunctivitis. Conjunctivitis. Okay. Adverse reaction क्या है? It is very less due to poor absorption. Sometimes it may cause bronchospasm, throat irritation, and cough in some patients. Now, last class is nothing but the corticosteroids. They are not bronchodilators. They are not bronchodilator. They will not inhibit the. They will not block the any inhibitor receptors, but they will inhibit the production of cytokinins and leukotrienes. So they will inhibit the cytokinin production, inhibit the leukotriene production, inhibit the eosinophilic lymphocytic infiltration, decreases the mucus productivity of the bronchi. They okay. They will relieve the muscle edema, suppress. They will also suppress the inflamed cell responsible for the antigen antibody reaction. Glucocorticoids offer a complete and sustainable relief in the from the symptoms of asthma, and they act as a okay. They act as a they act in a better way than bronchodilators. So bronchodilators क्या करेंगे? Quickly bronchodilation करेंगे, but they will not give relief, sustained relief for long term. But these glucocorticoids they will give you sustained relief from the symptoms of asthma. These drug improves the airflow and reduces the asthma exacerbations. They will have their own long-term adverse effect. Now systemic glucocorticoids, systemic मतलब orally देते हैं जिसको उसको बोलते हैं systemic glucocorticoids. Mainly prednisolone is used. They are used in a very few cases. For example, in case of chronic asthma, not controlled by glucocorticoids, inhalation glucocorticoids or bronchodilators. Prednisolone 20 to 60 milligram it is used. Okay, systemically. Then second is the status asthmaticus. So they are used in the chronic asthma, status asthmaticus, and COPD, chronic obstructive pulmonary disease. In case when there is a bronchodilators are ineffective and inhalation corticosteroids are ineffective. Bronchodilators ineffective है, inhalation corticosteroids. So these drugs are having high topical and low systemic activity. जैसे inhalation corticosteroids जो होते हैं उनको topically active ज़्यादा है, उनका systemic absorption कम होता है. These are the drugs with high topical activity and low systemic activity. For example, beclomethasone dipropionate, budesonide, then fluticasone, then cyclisonide. These are commonly used inhalation corticosteroid (ICS). ICS मतलब inhalation corticosteroids. Initially, they are used in the dose of 100 to 200 microgram at a starting, and then you can increase the dose, but should be less than 600 microgram per day. Suppress the bronchial inflammation, reduces the need of bronchodilators. Are used in the asthma, in COPD. Okay. Adverse reaction, long-term use of these inhalation corticosteroids, if beyond the dose of 600 microgram per day, they may change your mood. Osteoporosis, growth retardation in children, early cataract, hyperglycemia, pituitary adrenal suppression. These are the adverse effects on long-term use. और डोज भी ज़्यादा लिया तो ड्रग ऑफ चॉइस इन द अस्थमा, कौन सा ड्रग किस कंडीशन में ड्रग ऑफ चॉइस है? सो फर्स्ट कंडीशन क्या है? ब्रोंकियल अस्थमा. फॉर एक्यूट अटैक ऑफ ब्रोंकियल अस्थमा साल्ब्यूटामॉल इज ड्रग ऑफ चॉइस. फॉर एक्यूट अटैक इन द प्रेगनेंसी साल्ब्यूटामॉल इज ड्रग ऑफ चॉइस अगेन. फॉर एक्यूट अटैक ड्यूरिंग द लेबर, ड्यूरिंग द डिलीवरी, इप्राट्रोपियम इज अ ड्रग ऑफ चॉइस. फॉर एक्यूट अटैक इन द पेशेंट ऑन अ बीटा ब्लॉकर, जिसको बीटा ब्लॉकर दिया है उसमें एक्यूट अटैक आ गया अस्थमा का, तो उसमें बीटा तो स्टिमुलेंट नहीं दे सकते. इसमें क्या है? इप्राट्रोपियम. फॉर प्रोफिलैक्सिस ऑफ ब्रोंकियल अस्थमा ग्लूकोकॉर्टिकॉइड्स ड्रग ऑफ चॉइस. और दूसरा एक किसमें आता है कि मास्ट सेल स्टेबलाइजर. और कंडीशन क्या है? ड्रग कंडीशन में है एक्सरसाइज इंड्यूस्ड अस्थमा. एक्यूट अटैक में ड्रग ऑफ चॉइस है साल्ब्यूटामॉल. फॉर प्रोफिलैक्सिस ऑफ एक्सरसाइज इंड्यूस्ड अस्थमा ग्लूकोकॉर्टिकॉइड्स. Now, थर्ड कंडीशन क्या है? एस्पिरिन इंड्यूस्ड अस्थमा. एस्पिरिन का ओवरडोज हो गया तो अस्थमा करता है. फॉर एक्यूट अटैक साल्ब्यूटामॉल इज देयर एंड फॉर प्रोफिलैक्सिस ग्लूकोकॉर्टिकॉइड्स आते हैं. These are the drug of choice in the asthma. So this was regarding the respiratory system and drug treatment of asthma.